Welcome to the Sharp Healthcare CME Department Faculty Tip Series. Today I'll be talking about how to write gap analysis and learning objectives that are aligned for the most impactful and effective education. After today's presentation, you will have a framework that will allow you to develop measurable learning objectives based on the identified need and the desired practice of physicians and other clinicians. Before we get started, there are some interchangeable terms that you need to know about. 1. Some people say learning objective, while others say educational objective. They're both the same and can be used interchangeably. Desired practice and expected outcome are also the same. In a situation where you're talking about how you would like physicians or other clinicians to perform, saying that you would like the expected outcome to be physicians should be better at task A is the same thing as saying that the desired outcome is that physicians should be better at task A. Additionally, when identifying where the opportunity for improvement is and what needs to be better for physicians to be more successful and for patients to have better patient outcomes, you will use interchangeably often the word needs assessment or gap analysis. So what is a learning objective? I'm not going to read the slide here for you. I'll give you a second to read that. But the one thing that I do want to emphasize is that a learning objective is written from the emphasis of the participant and the perspective of the participant. These are not talking points for the facilitator or faculty person that they want to make sure that they cover. At the end of the day, as a faculty person, when you look at your presentation and you assess your participants at the end of the activity, what should they be able to take away from it? What additional knowledge should they have? What additional skills should they have acquired? Or what behaviors will they be able to go back and begin to practice? Additionally, as it mentions here with the learning objective, if you do a good job of selecting measurable outcomes and objectives, ultimately when you do an assessment at the end, everything should be aligned and it should be very easy for you to come up with your outcomes piece. So for example, if you're completing an online module and we've asked you for pre-test and post-test questions, if you've done a good job designing your learning objectives, your post-test questions should be pretty easy. They should be based on what you want the participants to achieve, which is what your learning objectives are. Now that we know what a learning objective is, how do we make one? The first thing that we need to do is we need to look at current practice. So what does your target audience currently know or do? And based on what they know or do, what would we like them to be doing? The difference between their current practice and what we would like them to do is what's called the practice gap. Again, as I'd mentioned earlier, this can also be referred to as a needs assessment. Once we have that needs assessment or that practice gap, then we need to figure out what measurable actions we can use to close the gap. Those are your learning objectives. So once you figure out what knowledge is needed, what skills the physician needs to know how to do, or what behaviors they need to perform, you've started to develop your learning objectives to address the practice gap. So how do we align all of this? Okay. At the end of the day, it's important to design measurable learning objectives and understand what your practice gap is, because ultimately it helps us define what our expected outcomes are, as well as, again, develop that learning assessment, whether that's a test, whether that's a reflective activity, or whether or not they're actually going to have to do a skills test to make sure that they have certain behaviors in place. So we've identified what we'd like our expected outcomes to be. We have our current practice. We now have decided what we would like the improved practice to look like, and we've decided what they need to know how to do and what they need to perform. When you're looking at that from a learning objective perspective, anything that someone needs to know how to do is competence. It doesn't mean they can actually do it, it just means they know how they should do it or what they should be doing. If we identify things that they need to do, that's performance. If we expect them to actually do a specific behavior and change a behavior from the current state to the new desired state. Once you have those things in place, as an educator, you're going to want to make sure that those learners actually did walk away from the education with the competence or the performance skills that they need to be more effective. So when you're designing your learning assessment, what happens is that you now have to design questions, whether they're case questions or other activities, to make sure that they can talk about what they should be doing. Ultimately, maybe there's a skills assessment involved where they need to talk about demonstrating performance. At the end of the day, all of this is about improved patient outcomes. While patient outcomes was not talked about directly here in this particular alignment example, really this is what we're trying to achieve. We're trying to make sure that our physicians are using evidence-based best practice scenarios, policies, and procedures so that the patients receive the best care possible and have the best chance for the most positive outcome. So let's get down to the writing of objectives. First off, keep it simple. You want to address one item in each objective. So you want to address a bit of knowledge, you want to address one attitude, or you want to address a skill. Right? Each learning objective, if written correctly, will have three components. It'll start with an action verb, it will state the conditions, and then it will describe what success means or what the desired behavior is. If you've forgotten, it's important to reference your expected outcomes or your desired practice list just to make sure that your description of success actually includes the desired practice and the expected outcome. Again, doing this correctly means that your post-activity assessment is going to be a lot easier. Let's look at a specific example. So here's an objective on the screen. Manage patients diagnosed with ovarian cancer incorporating stage grouping, evidence-based evaluation management guidelines, and clinical trial data. All right, so we want to identify all three parts of this objective. So the first thing that we're going to identify is the action verb. In this case, the word manage. The second thing that we're going to identify is the condition. We're talking about patients that have been diagnosed with ovarian cancer. And finally, we're going to define what success means in this situation with these patients. So success in this case is the ability to use evidence-based evaluation and management guidelines and clinical trial data when doing stage grouping. All right, so there's one example. So now here comes an opportunity to talk about where do these verbs come from. Okay, not every word that people want to use is necessarily a verb, and we'll get back to that. There are two particular models that we can use when we're trying to determine action verbs for our learning objectives to reflect kind of the level of knowledge or integration that we would like to take place. The most common one and the most familiar one, particularly in the United States, is Bloom's taxonomy. And you can see that the triangle goes from bottom to top with more basic information starting at the bottom with knowledge, and then increasing complexity with comprehension, applying, ultimately all the way up to creating, where people can integrate information and come up with a new point of view. You'll notice for each of these levels, there are different verbs that they recommend. For knowledge, they recommend things like define, list, recall. For applying, they recommend things like employ, illustrate, solve. For things like evaluating, they recommend appraise, select, support, evaluate. There are several different options of Bloom's taxonomy and different action verbs that you can use. I just recommend that you go online and find a list that works best for you. Just make sure you're using the most current version of Bloom's taxonomy as it was updated several years ago. The other model option that you have is the solo taxonomy. It breaks up learning in a different way and trying to group things together. Right? So there's 5 stages that you see here, and you can see that the first stage is that you don't really know anything about the topic. Unistructural is that you know one thing about the topic. Multistructural is that you know 3 or more things, but you're not sure when or why to use it. So you have the knowledge, but you don't know when to apply. Relational means you have a series of information, 3 or 4 items, but you also know when and why you should use it. And then ultimately, extended abstract is the concept that you can take this model that you've just learned and you can apply it to a new situation or in different contexts. This model is a little bit more familiar for those who maybe are in Europe or abroad. It's not as common here in the US, but it does provide opportunities for potential verbs. And you can see here's a list of verbs that can be used depending on which level of the solo taxonomy you wish to consider when developing your content. Now, as I'd mentioned or hinted to earlier, there are terms that are not measurable. Okay, you see a lot of these terms here, right? Please, please, please do not use any of these terms. If any of your educational objectives or learning objectives start with these words, you're going to want to take a deep breath, look at it, and try again. Mostly because these things are not measurable. You can't measure whether or not someone learned something. You can't measure whether or not someone understood something. You can't measure whether or not someone improved something. Not unless you're going to pre-test and post-test everyone anyway. Or how do you test for being aware of or being familiar with? That's kind of vague and we're not really sure what that means exactly. So for us to have a solid outcomes assessment, we need to make sure, again, that our learning objectives are measurable. All right, so here's a little bit of a test. I've got 3 objectives here on the screen, and what you'll see is I want to know which ones you think is the most effectively written objective on the screen. Is it the first one, the second one, or the third one? It's the first one. You'll see a very clear verb, evaluate. You'll see very clear situation, diabetes management, and you'll see very clear description of what needs to happen or the behavior that needs to happen. And we want better management strategies for A1C in order to achieve A1C goals in our patients. Now some of you might be saying, well, I think there's another one on the list that could be good too. And I'm going to go through the other 2 objectives and say either why they're not effective or how they could become more effective. So for the second objective, I did one of those things where I used one of those words that isn't really measurable. I can't measure understand. I don't know what it means to understand the risk. I can't show somebody how I understand something. Right? Other than that, this is actually quite a valid objective. Simply review the objective and change your action verb, and perhaps it will work for what you need. Additionally, what you'll notice, while we have good conditions, there is one other thing that we could possibly change here. It says prior to surgery. Right? It's a little bit vague. We're talking about anticoagulation. Anticoagulation could impact a lot of different surgeries. So, are we talking about cardiac surgery? Are we talking about general surgery? Are we talking about something else altogether different? And so ultimately, for this to be the best objective that it could be, we need to change the verb as well as be more clear about what type of surgery we're talking about so that we have clear conditions related to this objective. And finally, the third objective. We have list, and yes, that is a common verb that is appropriate to use. We can measure. But one thing that would help is that we actually need a number here. What if we were going to make a test after this activity that had this objective? List the latest staging criteria for breast cancer as published by ASCO. Well, how many things do I need to list to be effective in achieving the objective? Do I need to list 1? Do I need to list 3? Do I need to list all the criteria? And so when developing the learning objective and you're going to use list as a verb, you need to think about how many items someone needs to list in order for you to think that that objective is effective. So putting it all together, here's an example of an analysis of physicians' treatment of patients with Parkinson's disease or Parkinson-like disorders. And you'll notice with the current practice that the data shows that about a quarter of patients with clinically probable Parkinson's disease do not actually have the disease. And 21% of patients are incorrectly diagnosed with another movement disorder do have Parkinson's disease. Well, obviously we don't want a lot of false negatives and false positives, so we need to figure out how to more clearly evaluate patients who could have Parkinson's disease and differentiate between those that have Parkinson's and those that may have some other type of movement disorder. So you can see here we're trying to achieve that under our desired practice, where it says physicians will reduce the Parkinson's disease misdiagnosis rate by 5% over the next 12 months by employing evidence-based screening strategies. And you can see that's quite measurable. So any physician that participated in the education, we could track their ability to diagnose Parkinson's at this point and see if their misdiagnosis rate could go down over the next 12-month period. So what's the practice gap? What do we need to do for physicians to be able to improve their Parkinson's disease diagnosis and eliminate false positives and the false negatives? And that is where the practice gap comes in. An analysis of the difference between current practice and desired practice shows that physicians require additional skills in recognizing the signs of early Parkinson's. And we also need to help them increase the utilization of effective screening tools in order to improve the accuracy of diagnosis. So even if there are tools out there, if they don't have the time or space to implement the tools for the screening, they're not going to use them. So finally, from this, what learning objective or objectives can we determine? And in this case, we've actually come up with two. The first one, distinguish early Parkinson's disease from other Parkinsonian syndromes. All right, so that's going to help us have less misdiagnoses, correct? If we can do a better job of telling Parkinson's disease from other movement disorders, then hopefully people will be categorized correctly early on in their diagnosis process. Also, we hope that they can describe the most effective evidence-based Parkinson's disease screening and diagnostic tools. Maybe they're not using the tools because they're not familiar with them, or maybe some new tools have come out and they're not comfortable with them. So if they can at least describe the tools and how they work, then it'll be more likely that they could implement the tools in their practice. Finally, some additional tips for writing objectives. Everybody's a little bit different, and different statements help different people. Here at Sharp, all of our activities start with, following this activity, participants should be able to. And then your objective should plug in immediately after that, and the sentence should still make sense. So if your sentence doesn't make sense, then maybe your verb selection is incorrect. Additionally, if you struggle with finding a proper verb and gravitating towards wanting to use learn or understand or believe or become, which is on that list of terms we shouldn't use, try the hey mom watch me approach. If your mom can't watch you do it, then it's not measurable, and you shouldn't use that verb as part of your learning objective. Additionally, keep it simple. Do not compound verbs and never use and. So if you find yourself writing an objective where you say review and describe, perhaps that's a sign that whatever you're going to say after review and describe should be two separate objectives. Remember, we want to be able to measure each one individually. And it is always the hope that many professionals will come into the learning with some very basic knowledge, unless it's new technology, new information. And ultimately, you should strive to provide learning objectives that encourage physicians and other providers to learn beyond basic knowledge. We want them to really feel like they know how to do something new when they leave. We also want them to be able to feel like they can have a new set of skills and have an opportunity to perform new skills. So think about that when developing your objectives. Don't just focus on creating new knowledge and learning new information and how we can measure that. Additionally, if you have several objectives for a presentation, try not to start them all with the same verb. Really think about what you want the learner to take away and try to use a variety of verbs throughout to create interest. Finally, your take-home messages for the day. Keep it simple. One verb per objective and one object. Again, that's avoiding and using more than one verb in any given sentence. These learning objectives create the outline for your educational activity. You've done such great work to create the objectives, stick to it when you develop your content and you flush out the greater detail that you're going to present to your learners. Make sure that your learning objectives are based on desired physician and provider behavior, and close the practice gap. Your objectives shouldn't emphasize current practice. Again, remember, we're trying to move the needle here. We're trying to change something. We're trying to make something better. So what is it that the attendees and the participants need to know in order to know better and do better? And finally, and I've been hinting at this throughout, writing appropriate and effective learning objectives leads directly to relevant learning assessment techniques, whether it's case questions, simple multiple choice questions, some sort of debrief or reflective activity. If you do the work on the front end to write solid objectives, it will make everything easier on the back end, especially if you've been asked to engage in the outcomes assessment process at the end of the activity. That's all I have for this module. I hope you enjoyed the faculty tip series. As you'll see here are some references of resources that were used throughout this presentation. The links are available here, so you can download any of this content as you wish. Additionally, here are some other resources. Right? If you want a handout, you want to print something out just to have with you because you don't want to have to go back and listen to this presentation again, these are some options of things that you can download and print and have and refer to that will help you write solid learning objectives.